Hello, everyone, and welcome to this presentation on leadership in healthcare reform, focusing on the implementation of the Madani medical scheme. Let's meet the group members.
Healthcare disparities remains as a significant challenge worldwide, especially in developing economies. Access to essential medical services varies based on socio-economic status, location, and government support. Addressing these gaps is critical for public health and quality of life. The Madani Medical Scheme is an ambitious program designed to eliminate disparities in access and quality of healthcare services. The scheme focuses on increasing equitable access to medical facilities, upgrading infrastructure, and providing financial support to underprivileged populations. Rural areas often receive less than half the medical facilities per capita compared to urban centers, intensify healthcare disparities. These gaps lead to avoidable diseases, chronic conditions, and reduced life expectancy among marginalized populations. Previous reforms often failed due to inadequate planning for staffing and resource distribution, neglecting rural areas, and failing to engage stakeholders. Effective reforms require inclusive planning, strong communication, and stakeholder involvement. Leadership is crucial for overcoming resistance to change, resource allocation, and stakeholder coordination. Resistance often stems from fears of job losses, shifts in responsibilities, and uncertainty about service quality. Transparent communication and early engagement can build trust and foster collaboration. Leaders must ensure equitable distribution of funds, supplies, and human resources while maintaining long-term sustainability. Effective coordination aligns interests, streamlines efforts, and prevents conflicts. Navigating policy and regulatory challenges requires strategic leadership and alliances with policymakers. Training programs and regular evaluations ensure that new systems improve patient outcomes. The Madani Medical Scheme is a bold step towards reducing disparities. Its success depends on strong leadership and inclusive strategies. With effective leadership, we can ensure equitable healthcare for all citizens.
The theory or model that related to Madani medical schemes are effective healthcare reforms like require strategic and impactful leadership. Leaders play a pivotal role in navigating challenges, engaging stakeholders, and ensuring the reform meets its goals of equality, accessibility, and efficiency in healthcare delivery. Next, transformational leadership is key to implementing the Madani medical scheme, as it inspires and unites stakeholders around a shared vision. By highlighting the scheme's long-term benefits, such as improved access and equitable healthcare, leaders motivate collaboration among providers, policymakers, and the public. Serving as role models and change agents, they foster commitment and adaptability, driving successful reform. Promoting the Madani medical schemes require collaborative leadership to unite government, private, and civil society sectors. This approach builds trust, fostering joint accountability and shared goals. By efficiently utilizing resources across sectors, financial, technological, and human, collaborative leadership creates a strong foundation for the scheme's success.
In addition, the Madani Medical Scheme's core of healthcare equity can be profoundly understood via the prism of critical social change theory. Fundamentally, the theory contends that healthcare disparities are not purely coincidental but rather are a result of intricate social, political, and economic process that consistently marginalize some groups of people. This approach is directly applied in the Madani Medical Scheme, which specifically target the B40, lowest 40% income group, and other disadvantaged populations. The plan aims to dismantle the historical power structures that have historically denied underprivileged groups access to high-quality medical care. This strategy aims to radically restructure the healthcare ecosystem in order to provide more equitable access and possibilities going beyond surface level fixes. The theory's capacity to see healthcare as a crucial arena of social conflict rather than as a neutral service is what gives it the capacity to be revolutionary. Besides, according to sustainable development theory, healthcare is a wise long term investment in the prosperity of the country. This viewpoint is fully supported by the Madani medical scheme, which sees healthcare as a vital component of socio-economic advancement rather than just an expense. The program seeks to lower long term financial costs and provide a more productive workforce by investing in population health, especially for underserved populations. This theoretical framework acknowledges the crucial relationship between population health and the advancement of society as a whole. The application of the theory is demonstrated by strategic investment in health, a focus on healthcare prevention, prioritize the long-term welfare of society, and all-encompassing strategy for developing human capital. The approach highlights healthcare as a tool for social change that goes beyond economic factors. This is embodied in the Madani medical scheme by establishing fair access to medical treatment, resolving these systematic obstacles that have traditionally restricted access to medical care, encouraging social mobility via all encompassing health initiatives, and building an infrastructure for inclusive healthcare.
Next part is suggestions or solutions. The Madani Medical Scheme, a key initiative under Prime Minister Anwar Ibrahim, aims to provide equal access to healthcare for all Malaysians, particularly the B40 and other vulnerable groups. Rooted in values such as care, unity, and good governance, the scheme addresses socio-economic disparities in healthcare, contributing to improved public health outcomes and social inclusion. To strengthen the scheme, multi-sectoral collaboration is crucial. By integrating healthcare with sectors like education, housing, and employment, the scheme can tackle the root causes of health inequities. For instance, better housing reduces environmental hazards, while improved education leads to healthier lifestyles. Coordinated efforts across ministries can enhance the overall quality of life, making healthcare a part of broader social development. Next, targeted programs for elderly, disabled persons, and marginalized communities should also be expanded. Home healthcare for the elderly, rehabilitation services for disabled individuals, and subsidized treatment for the B40 group are critical to ensuring no one is left behind. These tailored services help bridge access gaps, impro- improving the well being of the most disadvantaged populations. Next, investing in a healthcare workforce is essential. Continuous training for medical staff ensures quality, patient centered care, while incentives like bonuses or housing assistance can encourage professionals to serve in underserved areas. This would address geographic and demographic imbalances in healthcare delivery, ensuring equitable access nationwide. Finally, strong monitoring and feedback mechanisms are vital for the scheme's sustainability. Regular evaluation using data analytics can identify gaps and inefficiencies, while public feedback platforms promote transparency and accountability. Engaging citizens ensure that their needs are met, fostering trust and participation. By focusing on collaboration, targeted care, workforce development, and accountability, the Madani Medical Scheme can pave the way for a more equitable, sustainable, and inclusive healthcare system in Malaysia.
Imagine a Malaysia where everyone, no matter where they live or who they are, has access to quality healthcare. That's the vision of the Madani Medical Scheme, rooted in social justice, fairness, and universal health coverage. This groundbreaking initiative focuses on those who need it the most, like the B40 group, the elderly, and people with disabilities. But to make this vision a reality, we need a diversified strategy. That means teamwork. Healthcare professionals, policymakers, and communities must unite. We are tackling the root causes of poor health like poverty, education gaps, and living conditions. Because a healthier society starts with addressing the social determinants of health. Services are being customized to meet the unique needs of disadvantaged populations, ensuring no one is left behind. The Madani Medical Scheme prioritizes sustainability, fairness, and transparency, creating a stronger and more inclusive healthcare system. Innovation is key. From community based health programs to digital health technology and public private partnerships, we are building solutions for a healthier future. But none of this is possible without trust and collaboration. Open communication and active involvement from all stakeholders ensure that everyone feels ownership over the initiative. We are addressing challenges head on, like bridging the healthcare gap between rural and urban areas and ensuring financial sustainability for long term success. The Madani Medical Scheme is more than healthcare, it's a step towards a just, inclusive, and healthier Malaysia.